Hello everyone, greetings from Richardsons Hospital, and this is just outside the OT arena, and this is a patient who is about to go for rhinoplasty. Now he complains of a deviated nose and also a nose which is slightly unpleasant he feels and not proportionate to his face. The main reasons being he has a dorsal hump, if we can see. Just turn on one side sir, idhar dekho. Yes, so his dorsum doesn't look uniform, it has a hump which is very evidently seen. Also, the nose has a drooping tip. The tip isn't one which is at a good angle or an acute angle, it is slightly bulbous and drooping. If we see from the frontal profile, the nose has a slight bend. He doesn't clearly remember, but he is saying he has a history of trauma, probably an assault when he was a child. That is the reason if we see there is slight bend and the tip is bodily shifted towards the left, and the tip also is ending at the left side very slightly. It's a very minute detail which we can only see precisely. Overall, he wants a nose which is proportional to his face. By that he desires a nose which has a narrow width, dorsal reduction especially by osteotomy, hump reduction and a better tip. So overall it's going to be a cosmetic rhinoplasty, yes, post-traumatic of sorts because he doesn't recollect the incident which has happened, and also functional I say because of the deviation he is having breathing issues, he says intermittently on both sides, and it aggravates during winter. So it's a functional and cosmetic rhinoplasty for this man who has travelled from the north of the country here for surgery. It's going to be an open structure rhinoplasty with him, and the scans has been explained to him, shown by Dr. Richardson, wherein there is a minimal chances of rib harvest. We'll see how we go on, proceed with it, and also till the time we'll follow it up till splint removal as to how he goes happily from here. Thank you.
70 kg.
140.
Start this cosmetic rhinoplasty. You can see there's a small hump. The nose is pretty broad. There's a sharp radix. So we're going to work on all of this. It's going to be an open structure septorhinoplasty because patient also has some breathing issues. Scan shows DNS or a deviated nasal septum. So we're going to be clearing that, and then in case we need, we're also going to go and harvest some rib for the septal work. So that's the different views. You can see the deviation of the nose towards the right side. So we're going to be doing osteotomy as well to correct that. This was a cosmetic septorhinoplasty. Rib was not taken. Osteotomy, various other grafts, everything used. And you can see the was also deviated nose. Patient had a hump too, flat alar bases. And I'm going to show you different views. This is the basal view also. Yeah. So there you see how the nose was before we started. You can see the improvement. Radix, dorsum, tip and length. Now the front view. Once again, see the deviation. The nose was moving on to the right. The tip was towards the right side. Now it's straight.
Very good morning. Greetings from Richardson Hospital. Here we have with us a patient on his 7th post-operative day of a closed rhinoplasty procedure. Luckily, this patient did not require a rib grafting already, but before the procedure we had informed him that he might. But as we went in, we thought that he doesn't. So that's maybe a good news for him, and he was really happy that he did not require one. So we'll first do the removal of the splint and show you how he looks. I'll just do it. So he's a 24-year-old male all the way from Delhi, and he's planning to go home in 1 hour. थोड़ा सा दर्द हो सकता है रिमूव करने के टाइम. दर्द हो रहा है ज़्यादा. ओके. So here we are after the splint removal, and if you see, when he came to us, what he had is a deviated nose more towards the right. So you can see the tip is now projected. It was towards the right. Now it is completely asymmetric at the center, symmetric and at the center. Also, he had a bulbous tip, and that has been corrected. In the lateral view, you will be able to appreciate the hump that was present, which has now been थोड़ा इस साइड देखो, थोड़ा नेक्स्ट सिस्टम इला अर्थ फोटो. Yeah. So you see this dorsal hump, so that has been eliminated. Today we'll be removing all his sutures before he goes home, and also showing the picture, showing the patient in the mirror shortly as to how he looks and how he feels about his nose. You can show him mirror. You want to record that? आप उसमें भी देखो और इधर भी देखो. फ्रंट पिक्चर चाहिए. देखो आपका जो ये डिविएशन था एक तरफ था वो सब करेक्ट हो गया. कैसा लग रहा है अभी?
पहले से
अच्छा लग रहा है. हाँ, ये सब स्वेलिंग है. So the swelling will take some time to come down, and ये सब almost 2 to 3 mm यहाँ पे swelling है रहेगा.
टच करने पे पता चलता
करेक्ट. हाँ, ये टिप का swelling भी कम हो जाएगा.
है. स्वेलिंग नहीं है, नॉर्मल है. यहाँ पे टच करने पे स्टूडेंट टाइप का.
पर आपको ओवरऑल कैसे लग रहा है?
पहले से बहुत अच्छा.
बहुत अच्छा. ओके. ये जो साइड में अगर आप देखेंगे, ये यहाँ पे कैसे ऊंचा था ना, वो हम्प था ना, वो निकाल दिया.
थोड़ा मोटा. थोड़ा स्टेज बैंड लग रहा है ना, थोड़ा सा.
नहीं.
अगर जैसे लग रहा हो तो नॉर्मल टेप वैसे लगा देते हैं.
पर नहीं लग रहा.
नहीं लग रहा ना.
आपको कुछ बोलना है? कैसा था आपका?
पहले तो मैम ऐसा था कि जैसे कहीं घूमने भी नहीं जाता था मैं, क्योंकि सेल्फी या बैक कैमरे से फ़ोटो खींचने में फ़ोटो अच्छी नहीं आती थी. इसलिए मैं रीजन से करवाने गए, ताकि घूमना बहुत ज़्यादा पसंद है, ताकि घूम सकूँ तो फ़ोटो अच्छी आए. इसीलिए भी आप, क्योंकि बैक कैमरे से सेल्फी में थोड़ा बहुत सही आ जाता था, बट बैक कैमरे से साफ नोज बैंड ऐसे राइट की तरफ दिखता था क्लियरली. इसी कारण से.
So as you heard, this patient says that he had low self-confidence, especially when he has to travel and click pictures. He wasn't. He never felt like taking pictures because of his nose, of the deviation. But now he says that he will travel and he will take a lot more pictures, and he's very happy with his nose now. And we wish him all the best. He's going all the way back to Delhi. He's leaving in an hour, and आप वहाँ जाके you send us a picture.
Yes, 1 month around.
Yeah, you send us a picture
yes.
after 2 weeks and 1 month.
Yes,
Okay?
yes.
Thank you.
This before and after we did a rhinoplasty. So we didn't harvest rib for him, no rib. Septal work done. You can see the nose was deviated. It's now made straight. We've made the nose more proportional to his face. The tip was very bulbous and large. Well, we've reduced it because it's super thick skin. It's reasonably pointy. It's going to get slightly more better because it's still a lot of swelling there. We've narrowed it a bit. I want to show you some other views. You can see here the hump. So it's a nice straight dorsum. Hump is gone. You can very, very clearly see the hump and how the nose is starting right from there. One straight line. Really nice masculine nose. Different views. ठीक है. You know Hindi or English?
Hindi.
Hindi. कैसा लगा आपको यहाँ पे स्टे? दर्द कुछ ज़्यादा हुआ?
नहीं सर, बिल्कुल।
और हमने आपको बताया था कि रिब शायद लेंगे,
जी जी।
और लिया नहीं, उसका रिफंड भी मिल गया था ना आपको स्टाफ से?
जी सर, सब वही सबसे बड़ी दिक्कत वही थी, घर वाले देखते ना कि रिब निकाला गया है क्योंकि उनको ये बात नहीं पता थी रिब की, ये पता है कि सर्जरी होगी। रिब की बात क्योंकि जाहिर सी बात है, घर में काम नहाने जा रहे हैं।
वैसे रिब निकालने में कोई दिक्कत नहीं होता, बट देखो अगर पेशेंट को रिब नहीं निकालना होता तो वैसे भी हो जाता है। हर पेशेंट्स को निकालने की जरूरत नहीं है।
वो तो कहेंगे कि
करेक्ट, वो तो सही है,
वो तो बोलेंगे
तो सब संतुष्ट है अभी फिलहाल।
जी,
आप भी हैप्पी हो?
जी सर।
चलो धन्यवाद, शुक्रिया, केयरफुली जाओ।
जी सर। सर इसमें जैसे नॉर्मली सर बैक कैमरे में सर ऐसे थोड़ा बहुत नोज बैंड की साइड दिखता है सर,
सीधा है एकदम।
ऐसे मिरर में
ये
सर,
देखो
मिरर में सर बिल्कुल स्ट्रेट दिखाता फ्रंट में,
एकदम सीधा है।
बैक में सर लगता है कि थोड़ा राइट की साइड में है।
नहीं।
मिरर में सर बिल्कुल स्ट्रेट दिख रहा है, लेकिन सर फ्रंट कैमरा में भी स्ट्रेट है, लेकिन बैक कैमरा में ऐसा लगता है सर जैसे राइट की साइड थोड़ा सा है। और सर
नहीं, एकदम स्ट्रेट है।
जी सर। और ये सब जो है अंदर सर ये ब्लड
वो निकलने के लिए 4 हफ्ता लगेगा।
हाँ सर, अभी इसको नहीं क्योंकि दर्द टाइप का और होता है घर पे, तो
वो तो अभी आपको दवा सब मिलेगा ना, दवा ले लीजिए।
सब कुछ सर कल ही ले लिया।
5 डेज के लिए जब आपको पूरा ट्रीटमेंट खत्म होगा, सब कुछ अपने आप ठीक हो जाएगा।
1 मंथ के बाद फोटो भी।
हाँ, कांटेक्ट कीजिए हमारे फॉलोअप नंबर में।
जी जी सर, नहीं तो सर मैनेजर सर का भी नंबर दे
पक्का?
जी
ठीक है
जी सर।
चलो, सेफ जर्नी।
सर एक फोटो आपके साथ
पक्का? यहाँ बैठ के लेना कि खड़े होके लेना है?
खड़े होते थे।
चलो हाँ, ऐसे लीजिए। ये इंस्टाग्राम में आ रहा है?
नहीं सर,
नहीं आ रहा इंस्टाग्राम में?
सर ये नॉर्मल है। या थैंक यू सर।
अरे ये सब मत करो, तो मैं भी आराम से जाओ, ठीक है? टेक केयर।